All right. Well, we'll get started now. This is our last Learning Collaborative call, and we have been just honored, and it's been just a pleasure to work with all of you over these last few months to create your strategy map and balance scorecard. On today's agenda, Terry will be leading us through some hospital discussion where you can report out on your progress on your strategy map and your balance scorecard. And Rhonda will be leading us through some education on how best to communicate your strategy map and balance scorecard with your board and your key stakeholders. And then we'll certainly have time for questions. The objectives of the Learning Collaborative have been to develop a strategy map and balance scorecard using those templates that we provided to you, developing metrics for the balance scorecard so that it will drive hospital performance, learn how previously selected shared hospitals have used the consultation reports to replace or supplement their strategic plans, and to apply best practice tools from the Rural Hospital Toolkit. Today's objective is to demonstrate value of the hospital for long-term success in the new payment and delivery model. I'm just going to turn things over to Terry now to lead us through this hospital discussion.
Thank you, Kim. Basically what we're looking for here is just basically give us a status of how you're doing on your strategy map or your balance scorecard. And I think this is really important since this is our last meeting, we'd like to know what we can do to support you as you move forward on your strategies or on your implementation of balance scorecard and strategy map. So even though the program ends here, we invite you folks to stay connected with our center to access resources there, or even just to give us a call if you have something in particular we can help you with. So, Kim, I'm not sure exactly which hospitals are on.
Oh, sure.
You want to?
Yeah. It looks like we have Lori from Mercy Hospital. Okay. We've got Tammy from Madison.
Lori, okay, and Tammy?
Mm-hmm.
Okay.
And White Mountain.
Okay. Well, let's start with Lori. Lori, can you unmute your line? It's star 2 to unmute, and just basically give us an update of what's going on at your hospital.
You mean from as far as the development of the map and the scorecard?
Yep. And
okay.
if there's other things that we can do to help you.
Okay. So I think I've gotten quite a ways down the road on the strategy map, but there's like every time I work, we've worked on it at different points and we still have some things to add. But and then we've taken the strategies that we have on that map and applied them with initiatives into the scorecard. There's a few areas that I haven't, or that as a team we haven't really figured out how to measure yet, but we may still need to work on those a little bit. But overall, I think we're headed the right direction with it.
Okay, good. In terms of the measurements, Lori, and that's always a challenge. And again, we've been doing balance scorecard for, good grief, it's been at least 12, 13 years, and it's still challenging to find the right metrics. Sometimes, you learn from metrics that you just discover, hey, that wasn't a very good metric, we tried it, and then the next year we will think about, try to be a little smarter about that in that regard. But it's always somewhat of a struggle. And again, the metrics should be something that is going to reflect your movement on your strategic plan. Are you moving down the road on this? Is this going to give you that kind of feedback? is this actually information that is going to be helpful for you? Because I think a lot of times there's an inclination to put measurements in there just so, we want to have, we're measuring things in that regard. So if it stumps you, one of the things you could do, for example, is to monitor the number. As long as you're putting your attention on it, you could be monitoring a potential number, and then maybe next year build that into the scorecard, et cetera. And I think we've talked about this in the past. There may be measurements that you think are really important to be on your scorecard, but if you can't think of anything that's really going to make some sense at this particular point to put on the scorecard, you can always monitor some of these as well, so that you're still putting attention to progress, but you're not sure if this is the right thing to measure. So you're simply, as a supplement to the scorecard itself, you're kind of analyzing those numbers, and that way you've still got your attention on it, but it hasn't been put in the scorecard where you may just feel it's not the right measure.
Right.
Yeah. So go ahead. Have you guys been working on a strategy map?
Yes.
How's that going?
Are you still talking to Lori?
I am, yes.
Okay. Yeah. So we've got several strategies in the map. The direction of the map still is a little bit confusing to me, but in terms of how things line up, but I think we're doing pretty good there. There's still a couple things we need to add, but we definitely have some things in each category that we're focusing on, and I think all of those things come together, to our bigger overall strategy. So.
Right. Again, one of basically the strategy map is designed to give you kind of a holistic approach in terms of your strategies. So, if your strategy is to expand services, let's do more outpatient services, then remember it would be what part of that strategy would really help to build infrastructure or train our people or create that the capacity to do expanded outpatient services, for example. And then in the processes, remember, then you'd be thinking, okay, on that outpatient services that we're going to develop, what sort of processes are we going to need to do? I mean, obviously, if you're expanding services, you're going to have to have different processes. And so you would be thinking about what is there in that regard. Then you'd think about what kind of customers, so under customers kind of in community, what would we have to do to reach out to those customers, for example? How do we get them in? How do we, kind of make improvements? Maybe we have to partner with another organization to do this, et cetera. And then on the financial side, it's like, what part of that strategy, how is it going to pay off from a financial standpoint? Will it diversify our revenue? What are we looking for there as well? So sometimes, kind of think of it as kind of in a linear fashion in terms of what you're trying to accomplish. And those 4 sections of your strategy map should help you to think holistically about how you're gonna make this happen.
That's a little bit where it confuses me between what's a strategy versus an initiative to meet a strategy. So some of those things you described to me fit under an initiative that you would do to achieve that overarching strategy.
Yep, so. Absolutely. And it's just a subset of your strategy in that regard. So if you think overall, as I said, you're developing initiatives as part of that overall strategy to kind of increase your outpatient revenue or your outpatient business in that regard. So if you think of it that way, there's actually no one right answer in this regard. So do what makes most sense for you. But in this particular case, you may want to think of the strategy as being broader, and then you would probably need, if you really think about it, you'd really need initiatives in every one of those 4 areas if you were going to pull something off
right.
of that magnitude.
Right.
So maybe that, I hope that's helpful.
Yeah, thank you.
Terry, this is Rhonda. Can I jump in and ask a question?
Sure can, Rhonda.
Okay, thanks. So, Lori, I know that our first meeting you said that you all were going to be focusing on increasing utilization of services and increasing your volume with operational efficiency. Did you still continue to focus on that?
That's one of the areas that we're looking at. Yeah.
Okay. So, Terry, let me confirm. So, for instance, increasing utilization of services would be the strategy, and then the initiatives would be the kind of like the actions or the things that they would be doing underneath that to actually be able to increase their utilization of services. So it might include marketing and things like that. Is that correct?
Yeah, that's how I approached it. Yeah.
Okay. And then I did have another question for you, Lori. Were there any particular measures you were really struggling with that maybe we could see if anybody has any ideas for those?
Let me flip through here just a second. Not specific to that, not specific to the one we just discussed, but one of the, well, it's kind of similar though. One of them was to provide the patient-centric care to build loyalty and increase market share. And one of the initiatives that I put under that just related to addressing complaints promptly and according to policy. But then I wasn't really sure on what to measure exactly with that. Because I don't think it's fair to say we have no complaints, because that's not how it works. But I didn't know that.
So maybe more around like complaints are resolved. So people bring their complaints, but then they're resolved.
Yeah, or possibly the number of complaints.
Do people ever measure that like per patient day or per month or I don't know. We don't get that many complaints, but turn it into some sort of metric related to volume or something.
Yeah. And then obviously on the, the volume would be relatively easy to measure. You could, in the learning and growth, you could be, if you're going to do like customer service education, for example, it could be, the number of people that were trained, for example, under learning or growth, or, there's a variety of ways that you could look at that as well. But again, as I indicated, for me at least, less is more on this in that regard. So if you, if you don't have every one of your measurements in there and you're just beginning, well, you're just like everybody else. You're just, but you'll find the ones that are good measures are going to be valuable. And again, I would not put, especially just beginning, I would not put too many measurements into your scorecard. You only have so much capacity for kind of focus and energy.
Okay.
And it seems like a broader overarching measure might just be with HCAP scores, willingness to recommend. So there would be several initiatives that would work towards that, and then the bigger measure would be willingness to recommend.
Okay, I did have that one down in there too, so maybe I just have too many ways that I'm looking at it.
Okay, yeah, that makes sense.
Yeah,
all right.
You could be, people tend, as I said, you might want to put too many measurements in on that, and as I think Rhonda is suggesting, maybe it's just you're only taking one out of your HCAPs and focusing on it. But I mean, pick the most important one, or the one that you think reflects what your strategy is actually expressing. Okay. And again, Lori, if there's anything that we can do in that regard, or you just want to call us and bounce ideas off us, or you're looking for, hey, I really need some resources in terms of, how do we do this, or et cetera, we'd be happy to help.
All right, thank you.
Okay, I'll turn to Tammy. Tammy, can you give us an update?
Tammy had to step out for a few minutes, so she requested to go last if she could.
Oh, okay. I will come back to her then. How about White Mountain? Who's here from White Mountain? Hit *2, if you will.
Can you hear me now?
I can, yes.
Okay, this is Tracy.
Hi, Tracy.
So we talked a little bit this morning about the balanced scorecard, and we did have some things that were more difficult for us. We had a hard time coming up with what do we measure, and I think your conversation with the previous person really did help. And then how to measure. So one of our examples was, so the topic we chose was telemedicine, and one of our objectives was to educate the community and that we would have a marketing initiative. Then we put, for measuring, we were like, number of marketing initiatives, is that, measurable? And then for what's going to show that we met that? Is it the number of referrals to telemedicine, that kind of thing? So that was kind of where we were struggling a little bit.
Mm-hmm. Mm-hmm.
And then how often are we measuring that? Are we going to do it weekly? Are we going to do it monthly? That kind of thing.
Good questions, all of them. So on the larger concept of telemed, so do you have telemed services right now, or were you thinking of marketing to get ready for them?
So we don't have telemedicine now, but it's something that we're thinking about coming up with. But we used it for our example for this, so as we did this, we acted as if we were going to do it right now.
Okay.
So that's kind of where we were at with that.
Yeah. But it kind of sounds to me in that regard, Tracy, that you might want to look a little bit broader on the strategy. To some degree, I think you've gotten into something that sounds a little bit more like an initiative to me, which is marketing the telemed, perhaps rather than the larger strategy of building and kind of building a telemed presence that's going to be used by the community and that the community will like, et cetera. So
okay.
Again, I don't want to redefine what you're saying, but that would be something that seems more like a comprehensive strategy to me. And I'll get to your marketing, I promise. And so one of the first things you could see would be, and again, thinking of a strategy map now, if we were going to have a vital telemed, and I'd say telehealth, the larger concept of this, presence here at White Mountain, what would we have to do? So one of the things we'd have to do is we would probably have to train our staff, or we'd have to acquire expertise in that area. So there might be something in learning and growth that you'd want to be thinking about. It's kind of like, what would we have to do to make that happen? What about space requirements, for example? One of a really good one, what about technology? We're going to need more cameras. We're moving to more and more of just using computers, et cetera. We'd want to look at that and maybe do an analysis of what our technology needs were, and then we'd want to look and say, okay, what are the skill set that we need? Let's say that. So that would be something that could be done in that area. Huh?
We did do that. So we took,
Good.
I was just using market as one example. So under learning and growth, we talked about training staff and
Good.
how we were going to do that. And we under, did I turn my page here? Under internal processes, we talked about workflow analysis. And that included also, what equipment we needed. And under financial, we talked about, making sure that we can get reimbursed and how much is the reimbursement and who will contract with us. So we did think about that. It was just a matter of, in each of those categories, trying to figure out, so what are we measuring? And it was good because we all worked together and we came up with these, but that just seemed to be the part that we struggled with the most.
I've got it. So the marketing is kind of the initiative that you're looking at in that regard, and you're wondering about measurements in that regard. By the way, good job on kind of looking at it at that strategy. You can see that's a multifaceted, holistic approach to your telehealth. And so now let's look at marketing. You could count the number of marketing and efforts, but that's not a really strong measurement because it doesn't measure the effectiveness of that. So but it might be, that doesn't mean you can't use it. If you can't come up with anything better, but it very well might be, did it, what was, I'm not quite sure what you had in mind with this in that regard, but you'd want to let the public know that it was available, and you'd be looking at initiatives to educate the public as well. And so were you thinking about hiring a marketing firm, or were you thinking about just educating the public, or both?
Well, we have a marketing person, but we were talking about having our marketer do that, and then how can we do that in community events? Because we're a small community. We have different fairs and different functions, and so how are we going to put that out there? And the example that we have is just really basic, but there's other things that we would do it if we were going to market it. We're going to do a lot of different things. But just for measurement, to me, it's the number of referrals we have. How many? Yeah. We have 2 this month, but now we have 10. And what marketing, what event did we do that got more people? That kind of thing.
Yeah, I like the idea of the referrals, because now you're really getting into, an outcome. It's a better outcome measure than number of marketing initiatives in that regard. So if you can find that. Rhonda, do you have any thoughts on this?
I guess I had a couple thoughts. One, it seems like the measurement at the very beginning of this would be one thing, and I don't know, Terry, that you can switch it later, but I'm just thinking that at the beginning, while it's just about creating the program and getting it up and running before it's actually even running, it might be more of a goal of a certain number of community outreach events per month, or a certain number of contact with local providers about the service per month. But then it does make sense that once it begins, the measure would be a little bit different, which would be about referrals. But I know you can't, I know that makes it difficult to think about switching measures in midstream, but it just seems prior to program implementation and after, it would be 2 different measures.
Yeah, and that's, and the other question was how often. And I'll tell you that here at the center, we do our measurement on a quarterly basis. So we have, and some people do it on a monthly basis. I definitely wouldn't do it any more frequently. It'll drive you crazy if you try to do it more than monthly. I'd say for most rural hospitals, quarterly would be fine. I know you guys don't have a lot of extra time to be putting into this, but yeah, the quarterly I think would work. And I think your suggestion, Rhonda, probably makes a whole lot of sense, and it kind of reflects something that I said earlier, and that is maybe counting what might be okay with the community events or the number of marketing messages you put out there. And then maybe in the second year, you could roll that into number of referrals you were getting, because it is going to take you some time to kind of roll out this program, and in that next year you could count referrals as on your scorecard anyway. Yeah.
Right.
Anything that we can do to help on this, or?
Well, we talked about today, I think what we're going to do, so we're going to start to work on our strategic plan and use this balanced scorecard. So I think what we might do is we'll probably be giving you, Terry, a call to see if you can talk to us on the phone and kind of give us some guidance when we start that process.
I'd be happy to do that, Tracy. Absolutely.
Okay. And then Greg was just asking too, on the balanced scorecard, do you want it for each, should we be doing it for each plan? So if we have, you know, this is our objective, then each one has to have a balanced scorecard? No? That
doesn't, again, think of it, keep it simple in that regard. Think about your big strategies. To me, the telehealth seems like a big one. So you'd probably want to reflect telehealth measures, and you know what? You don't necessarily even have to put anything in on the marketing effectiveness at this particular point. You can if you just want to count it, but you know, think about, let's say if you've got 3 major strategies. Think about, you know, again, looking holistically at it, what would be some key measures? You know, it's like, what would be something we'd always want to be looking at here to chart our progress? So,
okay.
Again, always, you know, simplify it as much as possible, but just make sure every one of the measures you put in there is really, you know, kind of crucial to the success of what you're trying to put together. I really don't advise putting any more than 16 measures max, and starting out with 8 to 10 or 12 to 16 would be perfectly okay as well. Remember, the scorecard it's a constant visual representation of what you're trying to do, and when you get too much stuff on there, people get confused.
That makes sense. Thank you.
Yep. Thanks.
You know,
Thank you, Tammy.
And the other
Go
thing
ahead.
that I think, the other thing I'm thinking, Tracy, is just that, you know, I think with any tool, it's important to make it work for you versus feeling like you have to conform to the tool. So do what makes sense for you guys so it's meaningful instead of feeling like, okay, I have to follow the letter of the law.
Okay, that makes sense too. Thank you.
Yep,
Sure.
that's a great clarification, Rhonda, because you know this is not medical procedure that has been put into cookbook balanced scorecard. What we find is that the innovation that occurs within the scorecard itself creates this great variability among the users of it. And I might have said this before, but one of our hospitals in Nebraska actually put this thing into a treasure map, and basically had a lot of fun with you know, the strategy being finding the treasure, and it was really you know, kind of fun and interesting the way they approached it, and people got excited about it. And the administrator actually dressed up as a pirate and came out and talked to his staff about it. I mean, that's how you get people's engagement. And so I loved it. It was perfect.
Sounds great.
Okay, Tammy, is Tammy available? Andrew. Did Tammy come back, or somebody? It's star 2 to unmute your line if you forget.
Hey, Terry, it's Tammy.
Hi, Tammy.
Hey, how are y'all doing?
We're doing good, but we're up here in Minnesota, and it has snowed 5 days in a row. I'm telling you, we'll do better when summer finally comes here.
Oh, well, it is already summer here, not spring anymore.
Okay.
I think yesterday the high was 90.
Oh, wow.
Yeah, sorry. Yeah. Ooh, I don't know what to do with snow. So at the table with us today, I don't know if our group is introduced because Lori and we presented kind of late because we were actually at a Kiwanis meeting giving an update on hospital operations and financial concerns. So at the table today, we have Chief Nursing Officer Cindy Coulter, Foundation Director Lori Evans, CFO Patrick McGee, and Human Resources Cindy Burnett. Just to keep in mind, our priority was data-driven decision-making. A lot of things going on behind the scenes regarding still trying to troubleshoot our tech infrastructure to create dashboards and see kind of what our electronic health record will allow us to do. I had a very productive meeting with our IT vendor that's a remote IT vendor, and he's going to be able to help us to set up dashboards and to extract the information that we need. It appears we will be meeting with him soon again to go over all of that information. But just an update on the medical staff engagement. We're still working on the balanced scorecard. It's a work in progress. Medical staff engagement, we have invited our medical staff, as we said before, to attend our monthly board meetings. We sent them an invitation for the March board meeting as well as the April board meeting, and no one attended. However, we had 2 people that said that they wanted to, but I guess they got pulled in other directions. And we are working on showcasing our medical team on our social media site. We started the kickoff during Doctor's Day. We were able to showcase one of the local physicians that is just kind of part-time in our community that's anticipating on selling a practice over in Tallahassee and coming over here full-time. He's very supportive of the hospital, which is a plus for us. And then the other one was just a radiologist. So we're working on that, and Lori has some great ideas on what we're gonna do to plug the doctors into social media and try to get them more engaged in supporting hospital activities and showing up for hospital activities. It's a work in progress.
You know, just a second, Tammy. We have an outstanding webinar on physician involvement. I don't know if you, but Dr. Clint McKinney, I think does a terrific job. And in my opinion, Dr. McKinney, of all rural physician speakers, is absolutely the best. And you know, maybe if maybe Kim would send a link in on that webinar presentation. I don't know if you've seen it, but I think this would be a real value as you move forward on the strategy.
I want to say I recall seeing that on your website where it has those links over there wherever. Well, when we were doing our survey and what our weak area points are, then it refers you to those links. And I want to say I recall that link being on there, but I have not watched it. But I'm glad you reminded us of that because I think that's important, and we will do that. Physician involvement.
Yeah, it really is. Dr. McKinney is just superb on this topic, and a lot of it is just you know, his thoughts on how to get physicians more involved in hospital leadership and hospital support, et cetera. It's right on topic, I think.
Well, we currently have a nurse practitioner that's going to be transitioning out of the emergency room. They're kind of burnt out of the ER environment, and they want to play a more active role on the admin side and hospitalist side for the hospital. So we will definitely be utilizing her strengths to help engage physicians to come to the table and to support some of our initiatives.
Good.
Okay, and department level engagement. So we had our group department management meeting in April to prepare our department managers for driving down to the root cause of process improvement. We actually, Lori was the facilitator at the meeting, so we just took one section of the strategic blueprint. It was the, what was the section? I can't help that. It was the finance section, and it was about the process for registration and admission and just the streamlined process of when the patient comes through the point of entry at the door until they leave the facility, making sure that we have all of those processes streamlined, from patient satisfaction to collection of co-pays, and the list goes on. So we're working that, and we're continuing to update the strategic blueprint. It's a work in progress. And like I said before, we're going to use that as a template with monthly meetings with the department management team. And we are in the beginning stages of working with the team to help them understand their role that they're going to play in the next 3-year strategic plan. And that strategic planning retreat is scheduled in August with the board, and they'll present at the board level.
Terrific.
We implemented the beginning stages of embedding the strategy to all workforce during, like I said, our live orientation sessions and group huddles. I know I mentioned last time about this book that we were reading called Building a Vibrant Community. So Lori and I, we introduced the book to the Madison County Development Council. They were quite receptive. And today we introduced the book at the Kiwanis group. So what we're wanting to do is to engage the community in selling the idea of, you know, sponsoring this book and giving it to their workforce and the business leaders of the entire community. And we have kind of come to join together and have a book club, so to speak, and we take each chapter, excuse me, and point out things that we need to do as a community and really push this community forward for sustainability.
Excellent.
Another thing that community engagement, we are partnering with the Hospital Auxiliary Group, which is our volunteer program, and we are having a joint fundraiser for a Mother's Day event. So we're getting a lot of feedback from the community. We're definitely in the spotlight right now on many levels. We're getting corporate sponsors, so people are seeing us more at the forefront instead of kind of lagging behind, you know, counting the cash to see if we can participate. Mm-hmm. I think that one is scheduled for May the 11th, so we'll know more about that as when that unfolds. You know, the main threat that we have, like all small rural hospitals, we wear so many hats. You know, we're pulled in so many different directions, and trying to pull all of it together is difficult. But we did hire a performance improvement director, and she is going to begin employment on June the 3rd. She has a background in performance improvement, of course, and like almost like I would call it almost like a compliance hat. She has a going around throughout the facility where she did work and just making sure that people were compliant with JACO standards for various department levels, and we feel like she will be instrumental in helping us to reach our goals on the strategic planning sessions as well as the next 3-year strategic plan.
Excellent. Boy, Tammy, you've really made a commitment to strategy, which is great. I also like the community work that you're doing. And again, even those hospitals that are isolated still lose a significant percentage of their potential business. And, you know, I might have mentioned this before, but we've been doing community surveys for years and years and years, and we always find the local community does not know what services you have available. They know there's an emergency room there, but if you ask them about anything else, they you know, an inpatient beds. But, you know, if you have cardiac rehab, I can just assure you the vast majority of people in your community won't know that. So one of the best ways to doing that marketing is, as you're suggesting, is get out, talk to the community. You know, we've seen it happen frequently when you start this community engagement. It pays off in greater business and greater, particularly in the outpatient revenue side of it. So good job.
Thank you, Terry.
Yeah. Rhonda, do you want to, should I turn things over to you? I don't know if anybody else is on that would want to.
Actually, Washington County Regional Medical Center is on. Antoine?
Oh, yeah. Great.
So Antoine, we've been taking a few minutes and people were checking in about their balanced scorecard and strategy map. Is there anything you'd like to add to that?
Hello, this is Heidi Coffey. I don't know if Antoine's on, but we're on. Dave and I are. How are you?
Terrific. We're great.
I heard about that bad weather. I just want to tell you it's about 86 degrees over here in Sandersville, Georgia.
You're killing us. We're just, every morning I wake up to snow at my house, so it's like, damn.
I know.
This is me.
I don't miss a moment of that.
So, well, how's your progress going?
Well, you know what? I think this month has been pretty good as far as communication goes because as I was listening to the other reports, Antoine and the team has been doing a great job. He actually brought our template, focus template, to the not only to the board meeting to update them on what we were doing as far as our general goals. He actually started to educate the directors. He brought that and pushed it out at one of our directors meetings and talked a lot about broadly about our strategies and then how we have to continue to develop our actions. And then we're not quite ready yet to engage them in how to assess it or work on the outcomes as much as we need to get them working on their actions. So he gave a couple examples of radiology on what perhaps the radiology person needs to do to engage in the goals and help with business development, as well as look at what she's doing as far as business development. And then we've engaged our marketing rep. She's doing much more out in the community. She's actually getting out almost daily and working on all our goals, whether it's customer service or driving more business to the ER. So, she's made rack cards, all different kinds of cards for marketing, letting the physicians know, going back out and finding if there are problems, connecting them to the right director. So we're kind of trying to work on first on those actions. The other thing is to tie in our quality and our PI to what we're doing too, so we're not doing so many duplicate projects. It's just too much out there right now. And then kind of tailing off what one of the other gals was talking about is that community engagement, and Antoine is out as much as possible. I mean, he goes to so many different kind of meetings, from the community church meetings to Archway, which is our community, working on our community assessment, to Lions Club, Rotary Club, you name it, any kind of club that invites them to go, he's out there. And when he's out there, he talks about our focus, our 2020, what the hospital's trying to do. So the community's getting used to that. So we can kind of tie that in once we work on getting our survey out, our engagement survey out to the community. We could probably tie a lot of that back. So we've got a lot of balls in the air. And then, we talked earlier this year about a lot of initiatives. Well, this month has been extremely busy in April. We actually went ahead and implemented 3 of the changes, which included outsourcing our PT therapy area and brought in those vendors and made changes. As of today, we outsourced our pharmacy, which was one of our plans, for business development. We've changed some of our accounting and financial departments. We've centralized them, as well as anesthesia. So we've had a lot of initiatives off of our report so that we can build our business.
Terrific. But it sounds like you made a lot of progress.
Oh, yeah. We may not have all written it all down, but we certainly have been working on it.
Yeah, absolutely. And again, we just really encourage you folks to call us. Remember, there'll be another round of participation and support for our small rural hospital transition program coming up here in the summer and fall. So, that's keep that in mind as you look at as you're moving forward here. But in the interim, make sure that you reach out to us if there's anything we can do to help. Rhonda, I'm going to turn things over to you so that you can do the educational pieces of our agenda today.
Thanks, Terry. That was some really good discussion, and I appreciate everybody getting involved. And it sounds like people were able to kind of bounce off of each other what they were hearing before. So Kim's put the poll up here. If you would go ahead and take a second and just respond to that. So we're getting ready to talk about communicating the strategy map and balanced scorecard to your stakeholders. So if you'll let us know where you are at this point, all the way from you feel very confident about that and what that would look like, all the way to no confident, not confident, unconfident, not no confident, sorry, unconfident. So while you guys are filling that out, I'm going to go ahead and talk a little bit about communicating. And it's exactly what you've been discussing as far as how you've been sharing this with the different stakeholders in your community and your hospital. So just as a reminder that the strategic planning, there's a cycle to it. It's not just an event. And so, certainly you guys began by analyzing and planning, and that is where you started pulling your secondary data, community health needs assessment information, and you started pulling together all that information to start deciding, okay, what do we really need to work on? That moves you into that document and communicate, which is what you've been doing with us for the last few months, where you're creating your strategy map, your dashboards, your strategic review meeting, that kind of thing. That moves then into executing the plan, and you guys, there's been some really awesome information today about ways that you're already executing the plan that you were putting in place. And then that fourth piece, of course, is to monitor and adapt, to figure out, are we making the gains we want to make? Are we moving forward? Do we need to make any tweaks or any changes? And then we do that, and then we look at that and analyze and plan. So it's a continuous cycle. It's not just a one-time event. As you're thinking about the communicating your strategy map and balanced scorecard, there's really kind of a continuum around that. And so it would be important for you to think about your audience and your stakeholders to decide where on the continuum I need to think about communicating. So, and I need to match that to the correct audience. So it goes all the way from, so it looks at two different variables. One is how much input do you want your stakeholders to have in the creation of your strategy, or how much you're in control of the end product. And so it goes all the way from telling where the stakeholders have no input at all. You're just going to tell them what the strategy is. And then the next piece of that continuum is selling, where you are hoping to get people more convinced and to commit to being a part of the vision or the strategy. So I'm just thinking about even with your staff, as you share this with your staff members, it might be more of a sell than a tell. So it's really about enlisting their engagement so that they're involved in wanting to be a part of where your strategy is going. Testing is where you would throw out an idea about your strategy and then really see what the stakeholders have to say about it to see whether or not they're going to support it. And then you can adapt or revise according to the input that they have. Consulting is where you're going to throw out some ideas, but you're really going to realize that, nobody has all the answers. And so I'm really going to start reaching out to other folks to get some input into the strategy. However, the ultimate product is still probably going to be your responsibility. And then to that far right of the continuum is the co-creating, and that is where we have more of an equal relationship. And so, for instance, perhaps maybe you go off-site and do a strategic planning, and the directors are there, your chief medical officer is there, and everybody has equal input into what that strategy is going to look like. So again, those are those ends of the continuum. And again, we need to think about, okay, what is our style of our hospital. Some hospitals are mostly about co-creating, but we need to make sure we're matching that communication style with the style of our hospital, and also thinking about the stakeholder and how much input they need to have into the strategy. Who needs to know about the strategy? You know, we often think about the obvious people like the board members or specific stakeholders, but I think it's so important to remember that we also need to make sure the hospital staff are involved in the strategy, because you guys know that you alone will not implement the strategy and reach the outcomes, that it's often the frontline staff or, you know, the folks working in the business office or who are really doing the admission database, for instance. Those are the folks that are really impacting the outcomes. So we need to make sure that there's a good line of sight so that everybody in the organization is on board and knows what the strategy is. Several folks have mentioned about engaging community stakeholders, going to Rotary, Kiwanis groups, other providers in the community. So again, letting those folks know. And then I think two groups we often don't think about is one is your state office of rural health or other grant funders or hospital networks, because again, these folks might have some really great ideas or resources that can help you to move your strategy forward. So we need to engage those folks. It's almost like our strategy shouldn't be our best kept secret. And then these are some questions for you to think about as you think about how to communicate the message to the stakeholders. And so in thinking about the different stakeholders groups, how much information that they need to know, who needs to know, what do they need to know, who should they hear it from, what results are expected. So for instance, I'm thinking about like your board, for instance, they might just want the more higher level and then the data. The staff might need to know a little bit more about what their part is going to be in implementing the strategy. So a little bit more in the weeds. You know, it might be that your leadership group, your managers and your directors are definitely more involved in the bigger strategy, but then again, those pieces of the operations that they need to be a part of. And so again, thinking about the different groups and sharing enough information but not overburdening with folks. So for instance, sometimes I see the board members, sometimes people will share so much information that it gets the board members down into the weeds of the operation of the strategy, where they need to really stay more on the high level of the strategy map and the balanced scorecard. So again, thinking about those kinds of things, thinking about where's the best place to share this information? Is it department updates? Is it an email? Is it a newsletter? And then are we going to use things like postings, huddles, those kinds of ways to communicate?
Almost reached out to them a few months ago.
And then lastly, I think I can hear some background. If everybody would please mute for just a moment, please. So lastly then, just thinking about communicating the strategy as far as to the board. One of the things that we encourage you all to do is when you're communicating your strategic plan to the board, start from the broader piece of the strategic plan. Talk about, are we executing our strategy well? Is the strategy working? Share a little bit about your balanced scorecard, your dashboard data, and then if needed, do a deep dive into one or two areas of your balanced scorecard, but probably don't do a deep dive into every single area of balanced scorecard, because again, that's going to be more information maybe than they want to know. At the center, one of the things we often do in our team meetings or our staff meetings is we do a deep dive into one area of our balanced scorecard, or one or two areas each meeting, so we don't cover every single piece every single time. This helps to keep us from getting so down into the weeds that we can't see our way out, but it makes sure that we are absolutely addressing issues consistently at a regular times. So again, with the board, you don't want them always getting down into the weeds of the operations, because again, you all are the specialists on those kinds of things. All right, so that was a very quick overview, as I know we're running out of time, for communicating information to the board, to your stakeholders, who to share information with, how much to share it. And also, I really like Terry's example about the treasure map, and even thinking about how will each stakeholder group best hear information. So a really dry report isn't going to be as engaging with maybe hospital staff as something that's a little bit more fun. So a few last steps, and Kim, while I'm going through these, you can put the post polling back up on the screen. So some last steps. Remember, please always reach out to us for continued support. Watch for an email. This is the first time we have done a learning collaborative for SRHT eligible hospitals that just wanted to sign up to do this. So we really are depending on you guys to give us some good feedback and your ideas on how to make this better. We do plan to do this learning collaborative again in the next year for us, and so we really would like your input on how to make that even better next time around. As Terry mentioned, over the next couple months we'll be sharing more information about the next application process for SRHT projects that will be coming out, and as a reminder, you complete an application, and it's a competitive cycle, and then we are able to take 9 hospitals per year, and we work with you for 18 months on a SRHT on-site project, and it's either a financial operational assessment or a transition of care quality improvement project. So again, keep an eye out for that information. We'll be sending emails to you all, and also it's always going to be in the Timely Transition newsletters. Any last questions, thoughts, anything in wrap-up? All right. Terry, anything final before we close this call up?
No, nothing that I can think of, Rhonda. Again, I just want to express my appreciation of our group. This has been experimental, we hadn't done this before, and I think it's been successful simply because you folks participated, and I'm really impressed with all the work that you guys are doing. This has been, I think, certainly a pleasure for us to be working with you. So thank you.
Absolutely. All right. Well, again, I hope to get feedback from you all about this when Kim sends out the SurveyMonkey. And again, let us know what worked, what didn't work. Let